There we are. Good evening, everybody. It is in fact 6:30 it's 6 o'clock in Leicester. It is 10:30 in Mumbai, where our very special guest is joining us from the great city of Mumbai. I know some have joined the call to participate and ask questions. Others are watching us on social media. So thank you all very much for joining us for the Chai Chat this evening. Our very special guest today is Dr. Ketan Pakal, who is a distinguished physician specializing in metabolic health, obesity, and dietology, with a fellowship in obesity, dietology, and endocrinology from the NHS in the UK and advanced training in endoscopic bariatric procedures. He's made a significant contribution to the field of metabolic medicine. His expertise spans obesity management, clinical cardiology, lipidology, and bariatric surgery. He's recognized globally for the work that he has done, and he was given the International Innovative Research Award from the World Research Council and United Medical Council. He is also accredited member of the World Research Council and a passionate researcher currently pursuing a PhD in metabolic medicine. He has this marvelous clinic in Mumbai, and I promise to visit him when I go to India in December. So, Dr. Ketan, you're very familiar with what we do. You have about 10 to 15 minutes to talk about your subject, and then we will have some questions for you. Thank you again for joining us. We're very grateful, especially that it's 10:30 in Mumbai.
Yeah. That's as I said, thank you so much once again for inviting me to the Silver Star Diabetes. And diabetes chai chat is something like I look after nowadays because I feel like home now because I've been connected for a couple of times. And Mr. V's sir is so amazing and so warm, welcoming. He gives so much of love and affection. I feel like learning something new and coming and speak in front of you people, because medicine and metabolic health is a vast subject and it's a very complex mechanism basically to talk about it. I'm sure in last few couple of years, most of them must have spoken about lot of diabetes, lot of complications, lot of other factors which influence to reduce the sugar or increase the sugars. I don't have to go much in details of that because I'm sure you must be knowing about it. But today I would be talking something which is going to be the root cause of the diabetes, and that is something diabesity and the weight of diabetes. So I gave my topic also in such a way that we should understand the weight of diabetes. It's a very heavy title, I can say. We are approaching to World Diabetes Day in next month, that is November, and theme is again about related to diabetes. But today I'm going to talk about the weight of diabetes. I'm sharing my screen. Can I request the host to allow me to share my screen, please?
Yes, you'll be able to share your screen now.
Thank you. So yes, so this is the weight of diabetes. I hope my skin is very much visible now. And the weight of diabetes. So weight of diabetes is actually going to tell two things. The weight of diabetes is increasing from the numbers about their population wise. The people are increasing up who are pre-diabetic and diabetic, and the sugars are also increasing. So the weight of this diabetes is increasing. And the second part, if I have to say, the core problem of diabetes is the weight. So more the weight, the uncontrolled sugars you have. So there are strategies for a dual management nowadays. And the weight of diabetes, here we go. And today we are going to talk about the diabesity part, that is diabetes and obesity. We would be understanding the diabetes weight connection. How we assess the patient, lifestyle modification, which is the cornerstone. I'm sure a lot many of you follow about the things. You have a very healthy lifestyle, you try to maintain that. We have pharmacotherapy, the procedures what we have nowadays, and something innovative things which we are going to have see today. So we all know that the rising prevalence is both for diabetes and obesity, that is diabesity, which is increasing globally, though it is in India or it is in UK. NHS is also heavily burdened with the diabetes treatment part as well. Interlinked metabolic diseases, the diabetes connection is very strong, though it is at a molecular level or on the blood parameters. Economically, it is a big burden, of course. More the weight of your diabetes is there, you are overweight, you're obese, and you have diabetes, dosages increases, so the economic part gets changed. So you invest more, NHS has a bigger number of shares, the dosages increases, though it is insulin as well, if somebody is on it. So dosages increases, so the costing of the treatment also goes up. So economic burden is huge. So if a person who is normal diabetic would have 1x treatment, whereas who would be overweight and obese would be twice or 2x treatment costing for the same. So healthcare burden of managing this condition is a big task. And molecular links are from the inflammation part, lipid overflow, or adipokines hypothesis. Adipokines is basically the adipose tissues which are present in the visceral fat, your abdominal fat, and overall fat mass, where more the adipose tissues and the cells, more would be a challenge to treat diabetes because of the insulin resistance. And this pathophysiology of diabetes is leading a major risk factors for the complications of diabetes. Adipose tissues, as I said, it is leading to insulin resistance. The medicine dosages, the diabetic dosages goes on a higher level, and insulin resistance occurs. Because of that, there is poor control over the sugars here. When you are overweight or obese, there is throughout the journey chronic low grade inflammation. So if we have doing during the COVID era, we must have done CRP levels, ASR levels, CRP levels, D dimer levels, you must have heard of. In diabetic and overweight patient, most of the times these levels are on the higher side, because body is going through a low grade inflammation throughout the time. And the impact of weight loss is amazing on these patients, because lesser the weight, the good control is over the sugars, which reduces the insulin resistance for the patients. So potential for diabetic remission in early stages is something which we look for. Now, how we assess these patients here? We assess through medical history, lifestyle analysis. You all know about metabolic health parameters. There are a lot of others: renal profile, kidney profiles, HbA1c, and lipid profiles. But very importantly, on the left side of the corner is something called as body composition analysis. This body composition analysis gives us a different picture altogether about the fat, mass, bone mass, water percentage, your free fat mass, visceral fat, and everything. So you understand the differences of the weight individually, what you have, leading to overall weight here. So individualized treatment, glycemic targets, and weight reduction of almost 5% or more than 5% gives a very good control over the sugars, over the cholesterols, over the blood pressures. So this is something which is on the presentation, but this is my own PhD thesis topic, which has shown a marvelous result when the people have lost 5% weight loss or beyond. That is something good here. So body composition, something I had a managing director of Tanita. This is the Tanita machine of body composition, who had visited just 20 days back to my own clinic. The photograph you are seeing, it's in Metabol, which is my clinic, and he had been representing Japan, where he came to clinic to understand about metabolic diseases here. So it was a very enlightening talk where he said India is different. Why I'm talking about India? Because I'm here now. But overall, also when he said, I feel, because my fellowship and I was taking training under NHS from Watford and Luton few years back. Then I came back to India. So I have a very strong connection with the UK as well, and that's how I'm connected with you people. So the whole purpose of putting this photograph and this body composition, because it was an intense talk where they said Japanese people are having blood pressure monitors very less at home, but 95% of the people do have this type of machines or a smaller version of it at their home. So they check their parameters, they check their body compositions, and accordingly they take care of their body. So when their weight is in control, there are lesser chances that they get diabetes, there are lesser chances that they get cholesterol issues or blood pressure issues. So a shift and drift of entire cultural aspect is something seen here. That was the discussion part. Now lifestyle modification is a cornerstone. Nutrition perspective, when we talk about lower calorie diets, where the calorie intake should be less than around 800 to 1000 calories less, and very less calories is less than again 800. So or maintaining 8 to 1000 is something giving a good change in your glycemic control. Mediterranean diet, low carbohydrate diets, intermittent fastings, which are you must have tried or you must have heard in details about the same, is giving a good control over it. Every important thing is physical activities, where you are just diet won't help, but you need to shed down some fat there with the exercises. So we called it as fit principle, that is FITT. That is the frequency, intensity, type, and duration of the exercises which you are doing. So it is a cardio exercises or resistance exercises and the core strengthening exercises all together, putting across on a single platter, if I have to say, around 230 minutes to 280 minutes in between. If you maintain or do exercises per week, you have a good weight loss or weight maintenance. Very importantly with this, if you don't have a behavioral changes and you are not highly motivated enough, these things goes for a toss. So cognitive behavioral approaches to substantial lifestyle changes is very important from the psychological point of view. Anti-diabetic drugs, your doctors must be knowing it, you must be treated on this. But if I have to talk about the weight and diabetes part, we have very new medications like GLP-1, which are now available in NHS as well. Semaglutide is one part of it, liraglutide is one part of it, which is giving good weight reduction as well as the sugar controls. Then we have something SGLT2 inhibitors like dapagliflozins. If you have heard of, the cardiologists also nowadays use it. It gives weight reduction as well as good glycemic control, and it is a cardio modulator medication as well. Now talking about specially anti-obesity medication, the only drug available and FDA approved is the Orlistat. None other than are there, because those are discontinued here. So role of bariatrics plays a very important role here. If you are super obese, you are into morbid obesity, to control your metabolic parameters, bariatric surgery is the key option. But as sir has mentioned, I am specialized into endobariatrics. I am not a surgeon, but I do endobariatric procedures, or say EBT, that is endobariatric surgeries or therapies in that way. And we insert a balloon into the stomach where you start losing the weight with that. Endoscopic sleeve gastroplasty is there, where we suture the stomach from inside, and it is giving a sleeve stomach, again giving a good control over the metabolic parameters. Now this is something called as body light balloon, which we offer, and we do procedures for quick weight loss. We don't have much of time, but this is a small video. I can just run fast and show you. A scope is inserted into the stomach and it is going inside, inflating the balloon inside, and it stays there for a year. After that, we remove this balloon out. This is how the we do the procedure in the clinic. Innovative part, if we have to talk, innovation is at the peak now. The role of telemedicines is very helpful, because now as I'm connected with you all, I have a lot of patients across the borders, say in US or say Germany. We are treating them after the procedures, putting them on CGMs. We have AI, what we are using, what machines they are using there. We get a notification of their weight and sugars on my desk here. So we are taking use of it. Personalized prescriptions for diet, exercises really help them. A quick thing, just a reel of 20 seconds. I would like to take you on for that. So this is something called as Allurion balloon.
I'm not sure whether we can see that, Dr. Balak.
Yes.
Ketan,
So
I don't think we saw that.
yes, going further with the management part again. Where was I? Yes. Then this is how the balloon works, and it gives a good satiety and weight loss, giving control to your sugars as well. If we talk about the case studies and clinical evidences, we see a successful patients who have lost good weight, and with their weight, their sugars was in good control. So the improvements over in quality of life with HbA1c and weight loss also seen. I've taken the consent of this patient who was 37-year-old. So I have displayed it because he had a good weight of almost 140 kgs, and he was diabetic. He was having cholesterol issues and sleep apnea problems. Where we started losing his weight, he came down to almost 29 kgs. He lost within a year. And with that, he came to pre-diabetic phase. He is no more on lipid agents. He's not on diabetic medications nowadays, neither he is on any of the sleep apnea machines. So the weight you lose, the better control is to the diabetes part. Of course, there are additional part where you can get control over your metabolic parameters like fatty liver, which can reverse your PCOD for the females. Infertilities gets improved because there are a lot of failures with IVF when there is overweight category, because most of the patients or the IVF people who are undergoing because of hormonal changes, they land up in their thyroid problems as well as in diabetic problems as well. So more the control with the lifestyle, which is the cornerstone treatment, you can achieve better results. So the conclusion and the takeaway is the holistic management with lifestyle, pharmacotherapy and interventions with collaborative actions with all the healthcare professions, and the platforms like what we are discussing makes a big change to motivate people for better control over the metabolic health. And very importantly, the global thread is about diversity nowadays. The more you see aware of it and control over it, the better would be the results and people would be having a healthy lifestyle. So thank you so much for your patience listening. And if you have any doubts and queries, we can address them now. Thank you so much.
Yeah, thank you for your presentation, sir. I think Mr. Vas just got disconnected. He'll be back again.
Okay, no problem. Absolutely fine. Oh, I see people guests joining here. I also see very familiar name of my friend, which is Dr. Steffi here.
Yeah.
Hello, Dr. Ketan.
Hi, how are you doing?
I'm good, thank you. How about you?
Absolutely great, yeah.
Lovely presentation.
Thank you.
Yeah, Mr. Vas is doing it again. Yeah, he's back.
I'm back.
Yeah, welcome
As-
back.
Thank you. Sorry, both you and I are outside the UK, so getting a line has been difficult. Thank you so much. I think I missed the end of your talk. Thank you so much for that, Dr. Palak. If you want to ask a question, you need to put up your hand, your little yellow hands. I want to start with a question. I think Manju is trying to get her hand up. Is that right? But let me ask the first question, which is, having bariatric surgery is a pretty serious thing to do in order to cure your diabetes. Do you have to be overweight in order to have bariatric surgery?
Yeah, so basically, the video which I shared, sir, was more of a bridge gap between the bariatric surgeries and the pharmacotherapy and the lifestyle changes. It is endoscopic bariatric procedures, which are reversible procedures for weight loss. And you need to be definitely into certain criteria where you are into overweight criteria of BMI of more than 28 with any comorbidities like diabetes, dyslipidemia or blood pressure issues or PCOD, where we opt for these patients who can go for the procedures. Going for bariatric surgeries, there are pros and cons. So is with the endobariatrics. Morbid obesity patients can prefer going for bariatric surgeries. But the things what we are talking about is endobariatrics, which is a procedure and not a surgery and a reversible procedure. So yes, we can go for it. BMI above 30 with no other comorbidity also. Patients who are going to be get married, who are having PCOD issues, and because of their stressful life or professional life do not give much of time to the lifestyle change, we offer them this procedure where they control over their weight as well as their sugars and other metabolic parameters.
Wonderful. Thank you so much for that. I think that we have no further questions, which I'm sure you'll be relieved at, bearing in mind it is now 10 to 11 in Mumbai in the night. But one or two have indicated that they would like to send in an email to you. If we could do that, and if you could reply to them, we'd be very grateful.
I would definitely do that. I would love to reply to those mails. Yeah.
Thank you. Dr. Ketan Palak, thank you so much for joining us. I look forward to meeting you and visiting your surgery in December. I will not be having bariatric surgery as yet, but if I was going to have it, you would be the surgeon of choice for me, I can assure you.
Great.
So thank you so much. You're welcome to stay. We now have the news headlines. But thank you again for joining us. And I should say to you good night, because it's now 5 to 11 in Mumbai.
Yeah, I would definitely take a leave because I have a procedure in the morning. So it was nice connecting to you as well as the team of Silver Star and Dr. Steffi as well. After I heard her voice after a long time. Thank you so much for connecting me once again. Bye and take care.
Thank you,
Thanks.
Dr. Pakal. And now we are going to go. You mentioned that you wanted to hear Dr. Steffi's voice. So Dr. Steffi is appearing with her voice. We go from Mumbai to Hounslow in West London, and Dr. Steffi will give us the news headlines of the week.
Good evening, Kitso, and good evening, everybody. Today's news headlines. The first news, diabetes warning to anyone who has had COVID in the last 3 years. Researchers found that adults who had mild to severe COVID were more likely to have suffered a heart attack, stroke, or died during the following 3 years. The elevated risk of heart attack, stroke, or death linked to COVID-19 infection was comparable to cardiovascular risk factors such as type 2 diabetes, peripheral arterial disease, and cardiovascular disease, according to the findings. The second news, eating 10 grams more of fiber will slash your risk of diabetes and cancer. Fiber works its heart health magic by lowering blood pressure and cholesterol and helping us maintain our weight. Enjoying a good intake of fiber-filled whole grains, especially whole grain breakfast cereals, oats, dark bread, brown rice, and wheat germ, seems to protect against type 2 diabetes, according to the research in the British Medical Journal. The third news, bacterial infection could bring on type 1 diabetes. Scientists have found that bacterial infection may have a role to play in the development of type 1 diabetes, as it can trigger the immune system to destroy insulin-producing cells. The proteins from bacteria may generate killer T cells, which then attacks insulin-producing cells. That's all for today's news, and good evening to everybody.
Good evening, Dr. Steffi, and thank you for joining us. We're nearly at the end. It's nearly half an hour. As you know, we like to keep it to half an hour. We did a free diabetes testing at Mano Medical Center, which is in Thurmaston. Rajiv and the team went out there, and a total of 225 people were tested. It was a fantastic day of raising awareness, and a big thank you to Rajiv and all the team of volunteers. So the mobile unit has been out quite often, and I'm very pleased to see the progress that is being made. It's been dormant for a period of time, but it's had its MOT, and it's out again. So that's it for this week. My thanks to Dr. Pakal, Dr. Ketan Pakal, to Dr. Steffi, to Rajiv and his team, and to all of you for joining us. For those of you who are online watching us, thank you too. And we will make sure that your questions are going to be answered by Dr. Ketton. In the meantime, have a great evening. For those of you who are in the evening zone, I am in the night zone with Dr. Ketton. So we will say good night, and we will see you again in a fortnight.